Let's take a look at the U.S. public response to the AIDS crisis. By 1990, AIDS was here, dangerous, and apparently here to stay. How did the U.S. respond? Let's explore the social and to some degree the psychological aspects of the disease. First, what was the psychological effect of AIDS on those who did not contract the disease? Here we enter what I'll call the realm of the mythic. It was generally believed in the late 1980s that AIDS would inevitably spread to the general population. U.S. News editor Mortimer Zuckerman stated, "It is a delusion to think AIDS is confined to homosexual men and IV drug users." On the popular TV drama St. Elsewhere, the plastic surgeon Bobby Caldwell contracted AIDS from a girlfriend, and Oprah Winfrey predicted that as much as 20% of the general population might die within several years. The Masters and Johnson's book, Crisis, Heterosexual Behavior in the Age of AIDS in 1988, suggested estimates of those infected that were off by 100% or more. The book concluded, the AIDS virus is now running rampant in the heterosexual community, but the book was based on small, unrepresentative samples. College campuses responded with clinics offering safe sex, sometimes required as part of freshman orientation with the distribution of free condoms. The U of Wisconsin hosted Condom Olympics with a mascot, Pat the Prophylactic, and candy bowls of condoms appeared everywhere. At Dartmouth College, AIDS awareness groups practiced slipping condoms onto plunger handles. But for all the semi-paranoia, AIDS never entered the general population. It did, however, affect the blood supply and IV drug users. The context for drug users was, of course, poverty. At shooting galleries on the street, they rented needles and syringes and reused them. This was the perfect breeding ground for the spread of HIV. Heroin and cocaine users were especially affected. One solution to the problem was the introduction of needle exchange programs. Addicts could exchange dirty for clean, no questions asked, and studies showed this to be very effective, up to 30% reduction in AIDS transmission. But in the U.S., strict laws prevented needle exchanges. There was strong opposition that came from politicians not wanting to appear to support drug use in spite of the program's success. No needle exchange program could receive federal funding in the U.S., the main reason being prejudice against this minority. Most, of course, opposed drug use, combined with prejudice against AIDS, and some even tacitly supported the status quo, allowing drug users to share needles, thereby increasing the risk of their dying. Contrast this to Britain, where addicts had access to shared needles. The response was a needle exchange program. Local politicians overcame opposition that argued that giving needles was condoning illegal drug use. By the late 90s, new infections were steady at 40,000 per year, with 40% of infections among IV drug users. Republicans who controlled Congress during the Clinton administration cast the problem in moral terms. They refused to fund needle exchanges. Hemophiliacs were also affected by social attitudes. In Anderson County, Tennessee, a 12-year-old hemophiliac was forced to leave school. In Florida, a family's home was burned because children had HIV, again hemophiliacs. And 14-year-old Ryan White, also hemophiliac, was forced to leave school in Kokomo, Indiana. Take a look at this YouTube clip summarizing Ryan's experience. Some response was milder. Dentists and other healthcare professionals began wearing gloves, but also police arresting gay demonstrators also wore rubber gloves. Such response is captured well in a scene from the film Philadelphia. Take a look. In 1985, Rock Hudson sought treatment for AIDS. He was the first celebrity to publicly acknowledge being afflicted with the disease. Take a look at the cover story from People magazine in 1985. His admission helped bring the issue to light, but anti-gay sentiment was already, as we have seen, deeply embedded in U.S. culture. At Dartmouth College, conservative students celebrated his death with a sorority party. At UKansas, fag-buster t-shirts sold briskly. Cleve Jones, founder of the Names Project, saw a bumper at a Republican State Party convention in California. AIDS, it's killing all the right people. Many on the political and social right sought to represent homosexual behavior as against the basic laws of nature, against God's intent. The Catholic theologian Eugene Clark stated, "Sodomy was at odds with basic Christian teachings. Sodomy is not a birthright," he said. "Like adultery and running a red light, it is a voluntary act, and like them, it has consequences." The Catholic Church generally rejected AIDS victims from the start. The epidemic challenged the Catholic Church's doctrine, and in 1986, the Vatican ordered U.S. bishops to stop any support of gay groups. The Church insisted on monogamous sex within marriage without use of condoms, and partly the difficulty with the Catholic Church related to homosexuality within its own ranks. In 1987, more than 20 priests contracted AIDS, and one study in the 1980s showed a substantial percentage of priests to be gay, maybe a majority in some urban dioceses. The response of the Church? Total denial. Southern Baptists were also intolerant. Their 1988 convention stated that homosexuality was a manifestation of a depraved nature, a perversion of divine standards. Fundamentalist Protestants also opposed helping AIDS victims. This was especially dangerous in the rural South, where minority populations were at risk. The disease continued to spread in the 1990s. In parts of New York, 25% of black men were infected, but those infected encountered denial and stigma. African American churches were not active in education, and black ministers were reluctant to speak out in public. Some more progressive denominations offered help to AIDS victims, counseling, shelters, emergency funds, etc. But moral majority leader Jerry Falwell stated, "Homosexuals and homosexual politicians have joined together to cover up the facts concerning AIDS." Pat Buchanan added his voice, "The poor homosexuals, they have declared war on nature, and now nature is exacting an awful retribution." And William F. Buckley added his voice, "Everyone detected with AIDS should be tattooed on the upper forearm to protect common needle users and on the buttocks to prevent the victimization of other homosexuals." And Anita Bryant, a popular singer and spokesman for the Florida Orange Juice Company, spoke for many. This clip shows the kind of mainstream objections the gay movement faced in the late 1970s. There was a political context at work here too. There was a shift in the country's mood. The great experiments of the 1960s showed disappointing results. The Vietnam War produced a crop of 50,000 dead. The Great Society of Lyndon Baines Johnson had limited results. Poverty and inequality remained. Faith in the solutions of big government was waning by the early 1980s, and many now turned to free markets and a reduction in government participation. Margaret Thatcher in Great Britain and Ronald Reagan came to power in the early 1980s, and in the U.S., the mandate to cut taxes and reduce the size of government was clear. Such attitudes had a political expression as well. Jesse Helms, the senator from North Carolina, in 1987 spoke out against a brochure describing a gay sexual encounter that he had received some federal funding. Helms pushed for a ban on any federal funding on any AIDS educational material that promotes or encourages homosexual sexual activities. Some congressmen actively fought to defeat federal budget outlays for AIDS research and prevention. William Dannemeyer of California, on the floor of Congress, stated, "God's plan for man was Adam and Eve, not Adam and Steve." By 1985, pressure was mounting. Reagan had not yet said anything about AIDS, and that year he made clear in a press conference that AIDS might be transmitted by casual contact. The Center for Disease Control responded immediately and violently, stating emphatically that AIDS was a blood-borne disease and could not be transmitted casually. At the same time, the CDC, a government agency, had its funding cut. All of this makes for interesting contrast to the public response to an earlier epidemic, polio. In the 1890s, polio was identified, and by the early 20th century, improved public hygiene and sanitation in the U.S. meant people were exposed as young adults, often from higher socioeconomic classes. Because those affected were higher in social status, society responded with great vigor, with highly visible national crusades such as the March of Dimes. So the nature of victims was directly related to how the public understood the disease. Interesting to note that 50,000 died from polio between 1900 and 1950, fewer than were killed by AIDS in the 10 years between 81 and 91. What was the effect on AIDS victims? Many were losing housing, losing jobs, being denied health benefits, and the victims also had to fight the bureaucracy of disability. Gay leaders responded. In 1987, thousands contributed to the AIDS quilt on display on the mall in Washington, D.C. By then, though, more than 40,000 had died. Cleve Jones, a gay leader, his idea for the quilt was a stroke of genius. The quilt as a warm, comforting, middle-class item and idea to draw middle-class support to this extraordinary catastrophe. Support did come, though. Reagan was president for the AIDS first decade. He gave only one speech on the subject and stayed generally aloof from the subject. He was clearly distant from the epidemic, and many, especially in the gay community, were vocal in their criticism. Yet in spite of the backlash and cuts elsewhere, funding for AIDS research was robust. Fundings were increased for research, education, and drug treatment every year between 1981 and 2005. Margaret Heckler, the HEW secretary, evinced public sympathy and came to the bedside of an AIDS victim in New York City. The Public Health Service AIDS resources grew from $5.5 million in 82 to $204 million in 86. Additional money was pledged to the CDC, the FDA, and the Mental Health Administration. By 1990, the Public Health Service budget devoted to AIDS was about $900 million. As early as 1983, the Public Health Service identified AIDS as the #1 priority. $15 million was earmarked for AIDS research. Lucrative NIH grants to AIDS labs from early on defined this period as well. In 1986, at a Public Health Service retreat, 85 experts developed progressive recommendations: education, voluntary testing, research, drug treatment, vaccine development. And in 1990, the House approved a bill for comprehensive care of AIDS patients at the cost of $4 billion, the Ryan White Care Act. But in spite of all these substantial efforts, by 1992, when Clinton was elected, AIDS had already killed 200,000 Americans, and another 1.5 million were infected.